Hey everyone, Jamie Amos here. Ton of work going on in the building here. This is the school and the orphanage building and the church that was built over a couple of years ago, and now they're finishing up a bunch of stuff. You can see a bunch of people from our crew doing a lot of things over there. So I want to show you inside the building and show you the flow inside the clinic. So what you won't do, I hope, is you probably won't be working and building out the flow pattern in your future office this way, but I want to show you the way we're doing it here. So if you ever work on a mission trip like this, you'll be able to do the same because it's working really well. Between 3 doctors, we're seeing just about 60 patients per day, just under 60 patients. And usually here we got a little lull. So right here in this area is where patients will sit. This is sort of the waiting room. This young lady here in the black shirt, she's actually our scheduler. So she's gone into the community each day and she's helped line up quadruple stacked patients. So everything's quadruple booked through these days while we're doing our clinic. So over here, in this room on the left, this is triage. So we've got 2 rooms. You can see this one over here on the right and this one over here on the left. So in triage, we have 1 chair reserved just for anesthetic and vitals. So come take a look. You can see how that looks. So we have 1 doc in here working all day long. We're rotating doctors in this room to do triage, vitals, blood pressure, and anesthetic. So once the patient's numbed up, they end up sitting in this chair here. And then yours truly, I act, I guess, a little like a traffic cop or an office manager, and I help bring the patients from that white chair into this room here. And this is the operative room. That's Katie. That's Katie, our new assistant. Very willing, very patient, very able. She's most improved player. She's gonna get an award for most improved, just so you know. This is one of our favorite patients here. He had some root tips taken out the other day. Dr. Crystal over there in the red. Dr. Crystal removed his root tips, and now he's back 2 days later after he's healed up a little bit for a prophy, for cleaning. Down in that chair over there is Dr. Mark. Dr. Mark is taking care of one of the family members of one of the guys who works here in the church. So I want to show you some of the chairs where we have a little bit of a lull, if this looks like a lull at all. I want to show you what some things look like, and then tomorrow I also want to show you some of the details of how the setup came together. So I'm going to show you a little bit of this, and then I will see you tomorrow.
Hello.
We have the best sterile techs on the planet. Best sterile tech on the planet. Have not missed an instrument or been down without an instrument even once. Okay. So that's all for today. Thanks for watching, guys. Look forward to giving you some more updates. Looks like we're filling back up out here. I will talk to you soon. Thanks. Take care. #triple operatory.